A very good morning to you, Mr. Scully. When we have armed forces at the capital's hospitals as being described as the NHS on a war footing, we've got a pretty serious problem.
Well, we know there's pressures on the NHS, and that's why we went into Plan B before Christmas. And we started off in a better position than we were this time last year, not just because there is a bigger disconnect between hospitalisations and case numbers, but also because we started the process the year with 3,000 more doctors, 10,000 more nurses than we did this time last year. But you're absolutely right. There are pressures on staff presences and people being absent, and that's why we put into place things like the digital staff passport, so people can move around, staff can move around hospitals far easier. The fact that we've brought in the military, as you say, to be able to support NHS staff, because we want to make sure that that people can get through this period in time of particular pressure on the NHS as best we can.
But this isn't normal, though, is it?
As we learn to live with COVID.
This isn't normal, though, is it?
No, clearly it's not.
The sight
clearly
of
it's
armed
not.
forces
No, absolutely
outside hospitals is not normal. And the MOD says that there's going to be more troops being deployed, expected to go to the north of England next. So there's more to come.
Yeah, it is. I mean, look, when you talk about armed forces, you know, around hospitals, they're not sitting there in combats or anything like that. It's more people helping out the undoubted pressures on the NHS, and that's why we want people to get out and get vaccinated and get boosted because that remains our best weapon against the pressures on the NHS and against COVID, as we learn to live with COVID.
More restrictions being called for by medics, by the NHS to avoid situations of having armed forces in hospitals. Are they still totally off the table?
At the moment, we're looking at the data, but we've seen what's happening in London, which was leading the way in the curve on the case numbers, and we don't see the need to do it at this moment in time. We'll clearly be reviewing our Plan B scenario before the 26th of January, and then we'll come to Parliament with the decisions that's been taken at that time. But what you find is that any plans and any restrictions that come in take weeks to get through the process of being infected with the virus, and then hospitalisations and, unfortunately, deaths. So what we're doing now is something that will affect the numbers in the NHS in a few weeks' time. That's why we're looking at the curve and the data on a day-to-day basis.
I'm wondering how united the government is on this, particularly at senior levels. Reports in the papers today that the Health Secretary has been saying that due to the loosening of travel restrictions, which we're seeing from today, that we could see more lockdowns. What's your view?
Well, I don't believe at this stage we need any more lockdowns. What we're doing today is we're announcing the fact that the money for hospitality, retail and leisure and accommodation is available now for those businesses that have been hardest pressed throughout this pandemic, and especially over that Christmas period when Plan B came in, for those businesses to be able to approach their local authorities to get the financial support they need. But what we've got to do is we've got to make sure that we can balance the needs of everybody within what is an incredibly difficult situation. The pressures on the NHS, but also the pressures on the economy, the pressures on households, jobs, livelihoods, and indeed money that's coming in to pay for the public services in the first place.
Yeah, you're talking about livelihoods there. I know you are the Small Business Minister. You're here to talk to us, of course, about business. It's very quiet out there, isn't it? It's a very low footfall in December. Was the guidance of work from home a mistake?
No, I think it's the right thing to do, to make sure that people remember that they have choices. They need the flexibility to be able to not get on the commute necessarily, be standing so close to people, despite the fact that, you know, obviously in London Underground and other and trains around the country and buses, people should be wearing masks. But nonetheless, if we're just disconnecting people in those sort of ways, that helps reduce the numbers of cases. Although, as I say, the case numbers in themselves are not the sole measure, because there is a bigger disconnect now between the case numbers and the hospitalisations, thanks to the vaccination programme and thanks to the booster programme.
Are you thinking about reversing that guidance about work from home, because businesses are suffering?
Well, I think what we've said is that we're sticking to Plan B at the moment. The 26th of January is the date for the review of that. So we'll look at what the data is saying there in the lead up to that date. But clearly we've got to get that difficult balance right, and that's taking the views of those businesses, taking the views of the scientists, and then making a judgment call with Parliament fully involved.
I know that you're coming on the programme because you're announcing funding today, some support for businesses, some COVID support. It looks very much like what you announced on the 21st of December. What is new today?
No, it is exactly that programme. What I'm saying today is that money is hitting the local authorities now. It's for businesses now too that are in the hospitality, retail and leisure to approach the local authorities to make sure that they can get that money quickly. It is available for them. We want to make sure that we can get the money to them now while it's needed, rather than letting it drag on for a few weeks, because we know that cash flow, I used to run small businesses for 25 years. I know cash flow is absolutely everything, especially at a pressured point like this. So any businesses that are affected in those sectors, please do approach your local authority.
You talk empathetically, Mr. Scully, about cash flow. We saw some fiery exchanges in PMQs on Wednesday. Is this a government that takes the cost of living crisis seriously? Because some people would say that perhaps the Prime Minister's response on that would suggest otherwise.
We take it really seriously. I mean, we know that the energy prices are an issue, that the people are worried about cost of living in general. That's why we announced the biggest cash increase in the national living wage since its inception to kick in April. That's why we got rid of changed the taper for universal credit, which puts £1,000 back into the pockets of the lowest paid as well. So we're trying to make these targeted approaches, whether it's the warm homes discount, the winter fuel payments. But at the same time, Mr. Scully, forgive me for interrupting, Mr. Scully. We do have this looming massive hike in energy bills. What is the government going to do about that? Well, look, we speak to the energy companies themselves with Ofgem on a regular basis. We've been doing that right the way through Christmas and New Year to really see what we can do with this global surge in energy prices. Long term, clearly, we need to make sure that we get rid of the fluctuations on the prices of fossil fuels by bringing in more renewables. But there is this immediate issue that you rightly describe about energy prices, and we're working with energy companies and Ofgem to see what more we can do. Well, the talk takes a while, doesn't it? And implementation also takes a while. So it doesn't sound like you've got any plans to immediately address this massive jump in bills that people are going to be seeing very soon. Well, what we've got is the targeted approach to help with fuel bills for the lowest paid in particular. So the winter fuel payments, the warm homes discount that target millions of the lowest paid households across the country to try and ease their bills. But clearly we'll make sure that we're working, as I say, with the energy companies to see what more we can do with those bills in the first place. I think a lot of people worried about their energy bills aren't going to be satisfied with that answer, Mr. Scully. But let's move on. Is it the right time to be raising national insurance contributions? Because some people in your cabinet would say not. Well, we know that we've talked about the pressures on the NHS, so that levy will initially go to easing the pressures on the NHS, but clearly tackling that long-term issue of social care, which has yet been untouched because it's been so difficult to resolve. But this is a progressive tax. It means that the top 14% of earners will pay about half of the entire levy. And so it is a progressive tax that means that if you earn more, you will pay more and contribute more to that difficult, intractable problem about social care. Mr. Scully, some people will say that the Conservative Party is way out of touch on the cost of living, just the way people need to live their lives, pay to put food on the table. I'm just wondering how in touch you are with all of this. Can you tell us what the national minimum wage is, for example, and the price of a pint of milk? Well, national minimum wage is £8.91. It's going up to £9.50. That sits with me. I mean, I don't buy my milk in pints these days. I tend to buy the 4-pint larger cartons. But you know, this isn't about.
Well, how much is that when you go and buy the large?
Sam, it's not about. Well, I buy it as
no,
part
but it's
of
it's about demonstrating to the public that you are a government that understands the cost of living and the pressures on people's budgets.
Sam, what it's about is it's about making sure that we have a massive pandemic. As you unwind that pandemic, you get into the global situations of supply chains, of energy costs, affecting not just people in Britain, but people around the world. We've got to make sure that we look after people within this country. What we're doing is we're targeting in particular the lowest paid,
Mr. Scully,
people that are on minimum wage, the people that are on universal credit.
Forgive me for interrupting. You have made that point. But while we are on the cost of living and whether the Conservative Party understands the pressures that people face, the Prime Minister, recent texts revealing he's asking, as we know about this already, Lord Brownlow for more than £100,000 to do up the tip, as he describes it, that he is living in. That strikes me as a party that is out of touch.
No, look, the Prime Minister, in terms of the issue around the flat, has put an apology to Lord Guy about the way the process worked in his investigation. We want to make sure that actually we are tackling the day-to-day for especially the lowest paid, but not just the lowest paid, the people that are pressed in middle earners as well, because we're all going through increases in energy costs. We're all seeing the increase in supplies, whether it's building work, whether it's just home improvements and all those day-to-day things that people are having as well, and food costs.
All right, Paul Scully, thank you very much for your time this morning on Sky News.